Chair. Thank you, Sir Patrick. Talking about vaccines, actually, we took some evidence, and it was really quite interesting to hear that we are ahead of the game in any other country. Health literacy is absolutely vital in regards to fighting coronavirus and the spread. People understanding what their role needs to be in fighting this virus. And I just wanted to know your views on a couple of things. Number one, ensuring that we have all information translated into various languages. That includes British Sign Language. We know there's 11 million people in the UK who are deaf and hard of hearing, and now that face masks are compulsory, they won't be able to lip read. And also we understand that the UK government's virus task force has 47,000 British, Bangladeshi and British Pakistani volunteers. And I'm just wondering your views on making sure that all of the information is provided in different languages to help the science and to help combat the virus.
Yeah, we've said, and our behavioural science subgroup's been very clear that that is absolutely essential, and have gone a little bit further to say that many of these things need to be co-created with those communities. In other words, it's not the translation problem, it's actually how you get proper co-creation. And the third thing is that I think very often community leaders need to be engaged with this as well, because it's not simply a sort of information, I've given it to you, it's done. It's an engagement process. So we strongly agree with that. And the report from the Academy of Medical Sciences, I think, made a very important recommendation, which is that there needs to be a strong and comprehensive public information and engagement campaign in early autumn in preparation for winter. So strongly agree with your point.
And the face mask people being able to lip read when face masks are widespread?
Well, I don't know what the answer to that is. I mean, it clearly is a big, one of the many big issues. There are others as well. So, for example, I've had colleagues, respiratory physician colleagues, who've spoken to me to say that their patients who've got chronic cough for other reason find themselves being stared at and shunted out of shops and things because people think they should be at home isolating, whereas they've got a reason to have a chronic cough. So I think there are some quite important things to look at here in terms of how we deal with all of these areas and how we make sure that we don't end up with people being selectively disadvantaged. And it's striking and incredibly depressing that this virus has not only exposed inequalities, but it has exaggerated inequalities. And that is a very important thing for us to keep in mind in everything we do.